Hi everyone, my name is Tonka Zacharowska and I'm going to present you my study case for this class about Anna, a tennis player who underwent an ACL reconstructive surgery after she got injured on her left leg. So let me introduce Anna a little bit more. Anna is a 20 years old collegiate tennis player who is recovering from ACL surgery. She had the surgery 11 months ago, had completed her rehab successfully, and she regained full range of motion and over 90% of symmetry in between her left and right legs. Now she's medically cleared from the physician for non-contact training, but she's not cleared for full participation in tennis play yet. So her main goal is to return to competition as soon as possible, but stay safe, be confident, both in her leg, have support from the leg, and also be confident on the court when playing. Uh, because she's experiencing a little anxiety about being re-injured, which is a very common uh, challenge for athletes after injuries, and especially something as serious as tearing ACL and having surgery on it. It's important to mention that her support team includes a physician, athletic trainer, strength coach, psychologist, dietitian, and head tennis coach on the team who collaborate closely together to make sure that Anna is ready to play strong and perform well again. So, as we all know, tennis is a sport with a lot of agility, power, a lot of explosive movements, quickness, acceleration, deceleration, changes of direction, lateral movements. So for Anna and her program Return to Sport is focused on strength, stability, neuromuscular control, biomechanics, and a lot of confidence. To be able to play and return to 100% playing and practicing, Anna needs to have at least 90% limb symmetry without any pain during the movements, has to pass hop test and landing performance test. Uh, we are going to be using also the LESS uh, landing error scoring system to check for her movement mechanics and also to evaluate her psychological readiness and confidence or fear of re-injury, the ACL RSI scale. So there are some risks of re-injury and how to prevent it. So in female athletes who are quadricep dominant and are not focused and don't activate glutes and hamstring enough, especially when landings. This is one of the factors that is at high risk for Anna. So we are going to focus in our programs on using the activation and strengthening of glutes and hamstrings and the general strength and stability in the posterior chain to help with the deceleration and landing mechanics, soft landing, using the posterior chain properly to help us keep safe and perform even better. Exercises that are great for our goal here are the glute bridges, Nordic hamstring curls, RDLs, plyometric landing drills, and they all help to rebuild stability, improve her knee control when changing direction, pivoting, or cutting in tennis. So recovery is very important for every elite athlete, and so it is for Anna, especially when recovering from injury. So Anna is going to be using cold water immersion for 15 degrees Celsius for about 10 to 15 minutes, within 30 minutes after exercise to reduce her inflammation, soreness, and the way she perceives fatigue. She's also going to be incorporating other strategies like active recovery, foam rolling, and nutrition, hydration, electrolytes, and it's going to be focused on getting a lot of good, consistent sleep between 7 to 9 hours for every night. And as in one of the podcasts, Dr. McHugh emphasized that the recovery is both physical and mental, and the timing of recovery strategies make a big difference in performance. It's very important that Anna is going to have a good and consistent timing for all of this, especially like an example using the cold water immersion within 30 minutes of post-exercise. To be able to evaluate how Anna is improving and what changes we need to make in her program, we are going to be using measurable data to track her physical but also psychological readiness and preparedness to come back to tennis. We are going to be using a hop test to measure leg symmetry and LESS test for landing quality. Anna is going to have weekly meetings with her performance team to help adjust her workouts, workloads based on her training, the data we collect, her confidence levels, and how she generally feels, what she may write down or consult with her psychologist or dietitian. So the program is going to have 8 weeks, and it's going to follow the linear periodization pattern with progression from focusing on the strength and the foundations to very sport-specific performance to make sure Anna is 100% fully ready to come back on course and perform well. So the first phase is going to focus on the posterior chain stability. It's going to be performed 3 times per week. And in this phase, it's about rebuilding the foundations, the strength, the stability she had and she may have lost when she got injured and she couldn't work out and exercise for a long time during the surgery and after surgery. The second phase is going to be focused on plyometrics and agility, adding a little bit of transition between the foundations and to the tennis specific drills. This is going to be a little bit of higher intensity. And then the last phase, the tennis specific drills, is going to be the highest intensity. And at the end of this phase, Anna is going to be ready to fully participate in unrestricted practice and full competitive schedule during her season. Here are some exercises that are going to be focused on control, coordination, agility, explosiveness, strength. So in the first phase, like very important exercises are going to be single like RDLs, hip bridges, Copenhagen planks. In the second phase is like skater hops, drop jumps, 5 and 5 shuttle runs. And the third phase, it's tennis specific rally simulations, serve recovery drills, and reactive cone drills, for example. To make sure that Anna is truly ready and feels good and is also very competitive, we are going to incorporate the exercise I mentioned, focus on speed, agility, and power, but also some exercises for rotation, because tennis, when we are doing forehand or backhand, we need a lot of explosiveness with also trunk rotation and core and back stability. So medicine ball throws are a great addition to her program. Anna is generally going to train 2 to 3 times per week. In the last phase, it's going to be 4 to go from moderate to high intensity. And it's very important for her recovery to have at least 48 hours of rest in between the sessions to make sure there are not any diminishing returns of the sport, and Anna is actually progressing the way we want her to progress and is staying healthy. And we are going to be monitoring her progress using objective, subjective measures, doing a lot of video analysis for quality movements technique. Coaches are going to be giving feedback, cues to make sure that she's actively transferring what is she learning and gaining in the weight room to the court, and it's also helping her tennis game. Nutrition is very important, especially when an athlete had a little bit of break in sport and is coming back to the competition. It's very important that Anna is going to have enough energy and the intake is going to be from whole foods and nutritionally dense foods. A lot of protein when she's going to have heavy workouts, 2 grams per kilogram of her body weight a day are necessary, with including some casein protein before sleep for overnight recovery. Before training or in the morning, collagen with vitamin C are going to support ligament healing, and hydration with electrolytes, a lot of vitamins, omega-3s are going to be helpful for her adaptation and overall health. And if possible, Anna can use creatine, which needs to be NSF certified to make sure that she's not going beyond any rules. And if she's getting tested as a collegiate athlete, she's not going to be reduced in her eligibility because of taking some banned substances. And creatine is going to help with PCR stores in her immediate system, helping with strength and power in practice or competition. Psychological readiness and being psychologically ready is also very important. So Anna is going to be meeting with her psychologist on a regular basis. She's going to be encouraged to do journaling to help her capture how she feels, what she feels, and what progress she makes when she refers to her notes back. Her primary goal with psychology is going to be focused on the visualization, goal setting, positive self-talk, keeping her motivated, encouraged, and striving to succeed and be competitive, and to be ready to play. Her ACL RSI score needs to be over 70 to be considered ready for the full play. And a little bit of timeline summary. So we are going to be using 8-week progression program from strength to agility to tennis specific drills. Once athletic trainer clears Anna to come back to full practice and competition, she's going to enter her maintenance phase doing resistance training 2 times per week with a lot of neuromuscular training, agility and balance work, including the recovery habits she has built over the program and still keep working on them. And we are going to reassess her progress, physiological, psychological, every 4 to 6 weeks to ensure her long-term performance and steady improvements. Because after the 4 to 6 weeks, we can see adaptations in her neuromuscular and biomechanical systems, so we can see what changes to the program we can do to make her even better and make sure that she's progressing. Thank you for watching, and here are some of my sources.